Hello, and welcome to the presentation that I am giving today titled What Every Bariatric Patient Should Need to Know About Vitamins, something that I hold very near and dear to my heart. I'm very passionate about, and I'm excited to share with you, the health-seeking bariatric patient. So I'm going to share my screen and move to the presentation. And I am a nurse practitioner, so I'm conventionally trained. I also have a certification in functional medicine. So my 25 years of bariatric nursing led me into seeking this kind of advanced certification, and functional medicine really looks at diving deeper into the body, into root causes of dis-ease or disease. And kind of throughout that training, I learned even more about the importance of vitamins and minerals and antioxidants and how they really keep us disease free and keep our body functioning well. And so applying that to my bariatric patients in my clinic really took my level of care to the next level and really started making a real big difference in those that I was serving. So I'm excited to share this with you. I want to start with why vitamins are necessary, right? There's a fallacy that people kind of think, well, I eat a healthy diet, so I don't need vitamins. And I want to just dispel that. If you have had a bariatric operation, you have altered digestion and absorption of certain nutrients in both procedures, whether it's sleeve gastrectomy or gastric bypass. The way that you process and handle food is different. And so there is definitely a need for vitamins and minerals in either procedure. Kind of the first component in either procedure is that there's a decrease in stomach acid production. In sleeve gastrectomy, which is the diagram on the left, we're removing a large portion of the stomach. And so that portion that's being removed is key for acid production. It's also the part of the stomach where the intrinsic factor is produced, and that intrinsic factor is what's needed to bind with vitamin B12 and iron for its absorption. So without that factor, there's going to be decreased absorption of those vitamins and minerals. In gastric bypass, the food that we're eating and supplements we're taking are not going through a portion of the intestine. They're going into a small stomach with decreased stomach acid production as well in that scenario, and then into the piece of intestine where some vitamins and minerals are not well absorbed. And so to accommodate for that fact, these vitamins and minerals are going to have to be taken at much higher doses, so that the portion of intestine that is receiving food and vitamin supplements are able to, even though they don't absorb all of it, they're getting enough to make up for that. The number two reason why vitamins are critical after bariatric surgery is because of a decreased intake. We are really restricting the amount of food that you can take in at one time in either procedure. And very commonly, there is a decrease in the variety of nutrients being taken in as well. So people will pretty much kind of stick with what they know works well for them. They're not typically adventurous eaters. They don't eat, the rainbow of fruits and vegetables. They don't consume them in large portions for sure. Typically in order to have what's considered an optimal diet for vitamins and minerals, we're supposed to be taking in roughly 5 cups of fruits and vegetables a day. There is no possible way a bariatric patient is able to do that. And so, yes, we're going to need to supplement in order to make up for the fact that we're not eating a big variety and we're not eating a lot of it. My number three reason why vitamins are necessary after bariatric surgery is that we don't eat enough of the good stuff. Here's a diagram of vitamins A, D, K, E, C, and the B vitamins and what foods they're commonly found in. I'm pretty sure that the majority of bariatric patients would not be eating all of these foods on an every couple day basis. So, when we think about some of these foods like broccoli and kiwi and spinach and carrots and sweet potatoes and broccoli and kale, they may be not consumed hardly at all, actually. So we're not really eating the full rainbow and not eating enough of the good stuff that we need to. And so because of that, we're going to need to get those nutrients somewhere. We don't have like a pantry of nutrients in our left butt cheek where we can just kind of pull from them when we need them. If we're not consuming them, we will run out. And there is nowhere to get something similar unless we are either taking it through a supplement or eating it through our food. So in a bariatric patient, let's talk about what vitamins should we be taking. For sure, everyone should be taking a complete multivitamin. We also should be considering the fact that we should take some antioxidants. Now, antioxidants are these anti-inflammatory, disease-preventing and oxidative damage preventing compounds that are found in healthy foods like cruciferous vegetables like Brussels sprouts and broccoli and cabbage, bright colored fruits and vegetables, grape skins, and green tea. So antioxidants help us to process the toxins that we take in. They help us to prevent our our cells from aging rapidly, right, based on these toxins. While we're losing weight, but really throughout uh, our lifetime, we need to be taking in antioxidants either in the form of foods that we're eating or through supplementation. Iron and vitamin B12 in both sleeve and bypass are critical. These are some of the most common deficiencies that we're going to see in either of these procedures based on the factors we discussed earlier. The lack of stomach acid and the lack of intrinsic factor that's being produced, as well as in bypass, iron is absorbed somewhat in the piece of intestine that is no longer receiving food, the duodenum. In bypass and in those with calcium dairy intolerances, which can be pretty frequent after bariatric surgery, that we see kind of some lactose intolerance. Calcium is part of the recommended supplement program, and as is vitamin D. Most people coming into bariatric surgery prior to even having it are going to show up with vitamin D deficiencies. It's very common in Americans. I mean, we live in Florida where we have sunshine all year round, and we see vitamin deficiencies in probably 85% of our patients coming through the door. So we're likely going to be treating vitamin D and then maybe doing some kind of lower daily dose to kind of maintain levels. So how do we know what you need as a bariatric patient or by your procedure type? Well, it's pretty simple because we have guidelines that have been put out. They were put out a long time ago. They're updated every few years. The most recent update was in 2020. And these published guidelines look at 100,000 postoperative bariatric patients in their labs, and they quantify what vitamin and mineral deficiencies this group of people is most likely to present with. And so we know that, 35% of people who have gastric bypass are going to have iron deficiencies. And so based on that, they put out recommendations for what supplementation is required or recommended to both prevent these deficiencies and treat them once they occur. And so it is recommended that you get routine checking of your labs. And so annual, at least, lab work done with the recommended levels to be tested. Our needs are going to change over time as we age, as we get put on different medications, as we maybe change our diet somewhat. And so annual testing is really the best way to kind of monitor and prevent and treat vitamin deficiencies after bariatric surgery. The guidelines are really scientifically written. They're easy. You can easily Google the clinical practice guidelines, and 2020 is the most recent update. But about midway through this 50-page document, it does go into what vitamins are recommended, what dosage, and also what laboratory studies to run on your patients. This is written really for providers, for medical clinicians. But I mention them to you, the bariatric patient, because let's face it, we were not taught bariatric surgery in our schooling. It is a unique specialty. Not every provider is really going to know much about bariatric surgery, if at all. They certainly are not going to know what the guidelines or the standard of care for vitamin supplementation or laboratory testing is. So I want you to be equipped with these guidelines so that you can give these to your practitioners. If they're unfamiliar, here's the guidelines. They may really be grateful that you provided them with the information to help you and other people they are serving. It's kind of like if you had a heart transplant and you went to another state and went to a hospital that doesn't do heart transplants, and you said, "Hey, I need my heart transplant checked out. Can you run some labs and prescribe my anti-rejection medications?" You wouldn't do that, right? Because that's not their specialty. They don't know the nuances of it. And so the same kind of applies to bariatric surgery. While it is much more commonplace than it was when I started in bariatric practice 25 years ago, it still is just not taught. And so providers are learning through us patients. And so I want you to make sure that it's, kind of take ownership, that it's really up to you to engage yourself with someone who does know the guidelines, a bariatric program that is certified by the American Society for the ASMBS Center of Excellence, or you go ahead and just provide these guidelines to your care providers. Ideally, you would line up with a bariatric vitamin line that clearly specifies that they follow these guidelines. There are lots of bariatric specialty vitamins that are going to meet the vitamin guidelines and are specifically made for your needs. It makes it easy. It's super simple. Just kind of be aware that you have unique needs. And if you don't want to educate yourself on the very nitty-gritty specifics, which I completely understand, you want to align yourself with providers who understand them, a vitamin line who is committed to meeting these requirements or these recommendations. And then last, remember that these guidelines are just the best general practice. They don't take into account our individual unique needs based on our diseases or our diet, our medications, our family history, our symptoms, our problems, or risk factors. While they exist to kind of prevent deficiencies in the majority of people, it's not going to prevent them in everyone. And this just further affirms our need for annual lab testing with all of the recommended vitamin and mineral laboratory markers, so that we can continually assess what our status is based on the vitamins we're taking. In our practice, we recommend the building blocks vitamin line. These are formulated for bariatric patients with the guidelines taken into account. They come in chewables and capsules, but depending on patient preference. But the typical patient is going to be taking a line that contains a multivitamin, a calcium, an antioxidant supplement, and an iron. They also can carry a premier product line, and this is a newer addition. This is a little bit more simple of dosing, and the multi-max absorb is particularly made for people who have issues with vitamin B12 absorption, chronic low levels of vitamin B12 absorption, or elevated homocysteine levels, which indicate poor absorption of B12 into the cells. The B vitamins contained in this multivitamin are in methylated form, so they're better for people who have B vitamin absorption issues. And then the CalMag Absorb, this is it's a calcium and magnesium product. It's 450 milligrams of calcium with 450 milligrams of magnesium, because studies show that calcium and magnesium in a ratio of 1-to-1 is optimal for calcium absorption. So we're trying to get people to be able to absorb the most amount of calcium out of the supplement that they're taking. In addition to the 1-to-1 ratio, this product also has betaine, which is a stomach acid factor that is going to really enhance the breakdown and absorption of the calcium and magnesium. We know that minerals require stomach acid to break them down and to really absorb them well. And we know that bariatric surgery means that we produce less stomach acid. So by putting this betaine stomach acid into the supplement itself, we're getting a dose of stomach acid with our mineral, and it's going to help increase its absorption. So it allows us to take less calcium and absorb all of it. And this is really beneficial because taking too much calcium and then it not getting absorbed properly is risky. Calcium is a hardening mineral, so we can get hardening of our arteries from taking too much calcium. We can also get kidney stones and other scenarios where there are things that are hardened that shouldn't be. So this product really is kind of designed to have a lower dose and absorb all of it. This is a sample schedule. So typically, because we know we can't take minerals at the same time, they compete for absorption. So like, for example, we cannot take calcium and iron at the same time. People generally take their supplements 3 times a day. So they might take a multivitamin and some calcium and an antioxidant in the morning, saving an iron for the afternoon, and then doing the morning regimen again in the evening. Some vitamin tips to consider that you kind of, as a bariatric patient, need to kind of know about. As I mentioned before, minerals are things like iron, magnesium, calcium, and zinc. They will compete with each other when taken together. So therefore, spacing them apart by at least 2 hours is recommended. So this means you should not take iron and calcium together. These two will kind of compete, and it's unknown which one you will absorb more of or in what amount. The only caveat to this tip is that magnesium and calcium, while both minerals, don't really have that same role, and they are actually synergistic when taken together. And so those two kind of make an exception to that rule. Another thing that impacts vitamin absorption is black tea. So if you're an iced tea drinker or hot tea drinker, you just want to avoid taking your supplements with black tea. This does not apply to green tea, however. It's the tannin specifically in the black tea that will kind of bind and decrease the absorption of certain vitamins and minerals. The next one is that taking supplements with food or at mealtimes does increase absorption rates somewhat. So it is preferred that you try to take them while you're eating a meal or maybe right before you start eating. The next rule or tip to consider is that when it comes to minerals, you really do have to take kind of smaller doses. So, for example, calcium, you really are limited to about 400 to 500 milligrams at one time. Taking more than that, you're really kind of wasting it, and it can be dangerous because you're not going to be able to absorb that amount. And the same would be true for like zinc and iron. Once you get to about 60 milligrams of zinc or iron, you're probably not going to absorb much more than that. So if you need higher doses than kind of like the 400 to 500 milligrams of calcium or 60 milligrams of iron, you're going to need to take them at separate times. So you might take 60 milligrams in the morning and 60 milligrams in the evening. If you have issues trying to remember to get in all the supplements, kind of like taking them multiple times per day, a lot of supplements you can take all at one time. So the multivitamin, let's say you're on a 3 per day dosing multivitamin, you can take them at one time. It is probably preferable that you space them out because you're going to get more of a kind of an energy boost from doing it that way. But if you're simply going to forget and most of the time not get in the second or third dose, it's probably best that when with a multivitamin or antioxidant, something that is not a mineral supplement, that you go ahead and just take it all at one time. To increase your compliance, we have to come up with a way to make vitamin taking convenient. For me personally, I have tried a lot of different techniques and I've settled on making vitamin bags. I get these small pill bags on Amazon and I make my supplement packs. So I have a morning, an afternoon, and an evening supplement pack. This way I have them where I can just grab them and put them in my purse or put them in my pocket and take them on the go. So that, when it's convenient, when I'm sitting down and I have a drink with me, I can go ahead and just take them. So I know that, different people are going to kind of respond differently and kind of need a different routine. Some people use pill sorter boxes, but I really recommend kind of spend some time once or twice a week filling your bags or filling your sorter boxes. That's something that can make it easy to grab and go. They're great for travel. I just pick out however many I need and I'm done. So this I have found to really dramatically increase my own compliance. And I really kind of encourage everyone to kind of find a system for their own selves that is going to work for them long term. Consider that this vitamin taking daily habit is going to be lifelong. So while certain supplements may come or go based on our needs at the time, there is going to be vitamins and minerals that we're going to be always needing to take. So it's best to try to figure it out the earlier you can in your process, the better, because we don't want to wait until we're vitamin deficient and then we have still not good habits of taking vitamins. And it makes really ever getting ahead of the situation really difficult. Some of the risks of not taking vitamins to meet your needs. And this also goes for not checking labs periodically, right? Because that's our validation that our supplement program is working. I have seen in practice really debilitating and permanent damage done from severe vitamin deficiencies left untreated for long periods of time. And because of that, I'm pretty passionate about teaching others, inspiring others to avoid these complications. We, as non-medical people, may not understand that for example, vitamin B12 and vitamin B1 are key factors to our neurologic system. So deficiencies in these can have devastating consequences. It may start out that you have some burning in your hands or feet, some numbness and tingling, some maybe cold to the touch, fingers and toes. It progresses to restless legs, to neuropathy. Maybe you're going to doctors and getting prescribed restless leg syndrome medication or neuropathy medication. And really, all along, it was a vitamin B issue. So I kind of just want to make you aware of some of these more common symptoms of these deficiencies so that it may at some point be a light bulb moment or an aha moment to say, hey, wait, Could this possibly be a vitamin issue? I better get my labs checked and rule that out. It should really be something always on your mind. So vitamin B12, we have peripheral neuropathy, numbness and tingling sensations, sluggish memory or brain fog, just general weakness and fatigue. We can have an unsteady gait when we're walking, so kind of a wobbly appearance as you walk for a really unknown reason. Shortness of breath, permanent paralysis can result if it's prolonged and without treatment. So most of these vitamin deficiencies can be reversed and the symptoms can be reversed, but there does reach a point that sometimes they can be unreversible. With iron, we'll typically see, people who feel lightheaded, dizzy, really tired, just needing to nap in the afternoons. They might have really brittle breaking nails. They might have low or sluggish thyroid function. They also will have brain fog, hair loss, shortness of breath, cold hands and feet. They typically will have a craving for ice, like somebody you see chomping on ice a lot. As a medical professional, we know they're probably iron deficient. They might get chest pain or rapid heart rate, and they actually, severe anemia causes an increased risk for heart attack. So, these are serious things. I mentioned the vitamin B1 here, it's kind of similar to the B12. However, with a thiamine deficiency, left untreated can progress into a coma and death if it's left long enough. With vitamin D, we have issues like bone pain or muscle pain. So just kind of achy sensation. We see depression. So low mood, really more fatigue, poor sleep, lower immune system, and poor calcium absorption. So bone losses can result from vitamin D deficiencies long term. Vitamin A, or also known as retinol, is associated with vision problems, particularly night vision, skin issues such as scaly patches on the skin. Vitamin K can result in further issues with bone loss or osteoporosis, and easy bruising, poor clotting, and increased risk of heart disease. For calcium deficiency, this is where we can see muscle cramps, muscle weakness, spasm, fatigue, irritability, a pins and needles sensation, and again, the bone loss. Something I run on my routine lab work for bariatric patients is a level called homocysteine. And an elevation in homocysteine is an indicator of either folate or B12 insufficiency in the cell membrane, through the cell membrane. So this leads to poor methylation, which when we're not methylating well, means we're not clearing things out of our system well, such as estrogen. So we have symptoms of high estrogen. We can have histamine issues, so allergies and headaches, poor toxin clearance, and homocysteine in of itself, an elevation in this marker is an independent risk factor for cardiovascular disease. So this is definitely something that we want to track. We want to use this as a lab marker. We want to measure it. We want to see where it is. And if it's elevated, we're going to want to make a change in supplements, and we're going to make sure that we're taking methylated B vitamins that makes it easy for the cell to just take the folate or the B12 into the cell and do the job. This works in lowering homocysteine almost always in bariatric patients. So in that building blocks line, the multi-max absorb was developed for this specific issue in mind. So to sum things up, a couple of key points that I want you to take away is that bariatric patients' biggest long-term risk is that of vitamin and mineral deficiencies, hands down, without a doubt. The sad part is that no one really talks about it. Doctors, surgeons, everybody, they might say, oh, you should probably take a Flintstone vitamin. And I'm telling you that in my 25 years of doing this, I have seen sad situations result from these vitamin deficiencies. Their vitamin deficiencies are easily prevented and easily managed before major damage is done. But it does require you to be diligent about taking the proper vitamin supplementation for prevention based on the guidelines and getting your labs checked at least annually. And again, the labs that the guidelines suggest are best. There are multiple mechanisms or reasons why deficiencies can happen in bariatric surgery and why supplementation is required to prevent them. A bariatric surgical patient's GI tract is not the same as a normal GI tract. It is altered on purpose for good benefit, but it does have sequela. It does have a downstream effect, and that is it decreases vitamin and mineral absorption. Annual labs are necessary. Basic adult screening labs are not enough. And you really should align yourself with a bariatric specific vitamin line that adhere to the guidelines that have been published for the dosages and the vitamins and minerals that bariatric patients should take. Just financial disclosure, I am owner and have financial interest in Building Blocks Vitamins. We developed this company 20 plus years ago when there were no supplement companies on the market to service bariatric patients' needs. Since then, there are many. But we have had the benefit of watching 15,000 or more patients take the supplement line that we've recommended, and we've been confident that people on the supplement line do maintain their vitamin and mineral levels very well. And so for that reason, I have the most experience with this line. Although, there are other lines out there, I do work with patients who use other lines. And so my advice is just to find something that aligns with the guidelines that will work for you and that you will take. Thank you for listening.